Good morning, and let's talk about a few words that might have caused some confusion yesterday. Social distancing. It is reducing the number of social contacts you are having. Right now, the CDC is recommending that we do not congregate in more than groups of 10. And that is because we're trying to flatten the curve. Another phrase that people were asking, what does that mean? We're reducing the number of exposures. That's flattening the curve. We're trying to reduce the number of infections that are going on at a single unit of time, like today. And we're trying to do that because our hospital systems are not prepared for the number of infections that would happen if we were not implementing social distancing. This is a virus that can cause respiratory failure. And so my goal is to educate why we want to implement social distancing. This is a virus that is novel, meaning it's new. All of us are susceptible to it. The degree of infection and complications can be dependent upon your age and your comorbidities, another word for having other health issues like diabetes, being overweight, having asthma or autoimmune conditions. And so that's why we also want to reduce exposure, because we're trying to reduce the severity of disease in our patients who already have health issues. So when this virus is not overwhelming our healthcare system, we have enough modalities to support those who are ill. And so right now, if you've hoarded masks, please donate them. Do not hoard masks. Our healthcare system needs them right now. And how about we show some love to those who are in the trenches of fighting this? If in your neighborhood you have a nurse, a doctor, a PA, a therapist in there, this is great for you to help get your kids out. Go mow the lawn, pull the weeds, do a grocery run for them. We can unite as a community here, and we can do the small things that make a difference. How about we ask who might be needing some toilet paper? I know some people, and I've seen some blogs where some even maybe independent living places or homes are running out of toilet paper. How about if 10 of us donated one roll? Think of it, they'd be set for a little while, or a box, a padding of toilet paper. So let's do things in a positive fashion, because when we get rid of the negativity, it's so much better. Think about the things like you can do with your kids, playing games, going for a walk, go on Pinterest, find some new recipes, and cook something different that you've never thought about. Exercise, get them involved, hold a plank or a push-up. It's really cute what you can do with your kids too. They're watching us. They want to know that there's safety in this. And I think when you have open conversation and you discuss why we're not having them get in big play groups, and why we're not going to a restaurant tonight, that is comforting to them, because you're explaining the why part. You don't have to go into detail, especially let's say with a 3-year-old, but I have 17-year-olds and they would definitely want to know the why part to this. So be open, have an open conversation, communication, and I'll keep the information coming too. So hopefully this was helpful for understanding why we're trying to flatten the curve and why we are implementing social distancing.